The Trump administration just announced a massive crackdown on Medicaid fraud by targeting the state with one of the lowest Medicaid fraud rates in the entire country, which is a little bit like declaring a war on littering and handing a ticket to the one guy on the block who actually picks up his trash. Dr. Mehmet Oz, who you may remember from his decade of television suggesting that green coffee bean extract would melt your belly fat, now runs the federal agency that handles health coverage for tens of millions of low-income and elderly Americans, and he just froze $259 million in Medicaid payments owed to Minnesota to send a message about protecting the vulnerable people who depend on Medicaid, and that message was apparently, tell your governor. Right, so the day after Trump's State of the Union declared a national war on fraud, Vice President J.D. Vance and newly minted CMS Administrator Dr. Mehmet Oz held a White House press briefing to announce the first target: $259 million in Medicaid payments owed to Minnesota, frozen, with Governor Tim Walz given 60 days to submit a written plan to fix the problems, or face up to $1 billion in blocked payments by year's end. What they didn't mention in the room, and what I want to walk you through after you watch this, is what their own agency just published about Minnesota's actual fraud numbers, and which states, with far worse records, somehow didn't make the list. Let's watch what happened, and I will break it down later.
So CMS is done paying and chasing. We don't think jail sentences are the right way out. These criminals flee the country. Many are foreign nationals. Instead, we're launching the largest action against fraud that we've ever taken. The money's not going to ever leave the building again. We're going to start draining the swamp of the crooks that have inhabited it and are defrauding us. There are three bold actions. The first, and for many of you maybe the most important, is we're going to, for the first time, take a massive action to defer funds to a state. Let's start with this Medicaid program in Minnesota, which serves pregnant women. Medicaid takes care of our children. 53% of kids are born into poverty. They're supported through Medicaid. Disadvantaged seniors, individual disabilities. It's imponderable that you would take advantage of these precious programs, yet they're putting it at risk, all of it, by stealing the money. So it's our duty to preserve Medicaid, and what we're going to do is identify the scammers, which we have done in Minnesota. We've identified that they've hijacked, in particular, a certain part of the Minnesota Medicaid system. Said differently, and I'll just put the numbers out there, it's going to be $259 million of deferred payments for Medicaid to Minnesota, which we're announcing as I speak to Governor Walz and his team. And that's based on an audit of the last 3 months of 2025. Restated, $250 million is not going to be paid this month to Minnesota for its Medicaid claims. Now that's $250 million of money. That's your money. It's your taxpayer money. And these home and community-based services, which again are services that are typically things you would do for your family, but for whatever reason your family's not there to provide them, are very hard to audit. And for that reason, there's been a lot of slippage. The guardrails have not been well maintained, and if you're not serious about the integrity of the program, you'll see these problems happening in your state, which is why Minnesota's not alone, although they're the first to receive this action. These high-growth areas of fraud are difficult to police, so we require the states to take these issues seriously. This $250 million deferment is hopefully going to get on the radar screen for the state of Minnesota and make sure they are responsive to our requests. We did what any honest and patient-focused agency would do. We have notified the state and that we will give them the money, but we're going to hold it and only release it after they propose and act on a comprehensive corrective action plan to solve the problem. If Minnesota fails to clean up the systems, the state will rack up $1 billion of deferred payments this year. Governor Walz has 60 days, sir, to respond to our letter. And if providers and beneficiaries are worried about getting their money and services, please call your governor. These are services the governor has already paid for. We are just not reimbursing the state. And to make it clear, there is a rainy day fund in Minnesota, so we are very confident that people will not be hurt in Minnesota. This is not a problem with the people of Minnesota. It's a problem with the leadership of Minnesota and other states who do not take Medicaid preservation seriously. Any delay in services is going to be, should be laid at the seat of Governor Walz. I believe he will take this seriously. They're not the only state that's floundering. We have more announcements from other states coming soon. Second big issue has to do with Medicaid.
Okay, here is what you didn't know while you were watching that. Last month, and I want to be precise about this, his own department quietly released official federal review data reported by CBS Minnesota, showing that Minnesota's Medicaid error rate is 2.1%. The national average, according to that same CMS report, is 6.1%. That data was compiled before Minnesota had even finished putting its new anti-fraud measures into place. Georgetown University's Center for Children and Families, which tracks Medicaid policy, noted that Minnesota's error rate has stayed steady at around 2.2% for 4 years straight and sits safely below the 3% limit that Congress itself set as the cutoff point before a state can face federal penalties. The Georgetown researchers wrote, with admirable understatement, that it is, and I'm quoting here, not obvious how those results are consistent with his ruling that Minnesota is in serious violation of federal requirements. Translation? They're being polite. Their actual word for the action was partisan. Not my word, theirs, in an official research paper, which in academic circles is roughly equivalent to flipping a table. Now here's how this actually works, because he was very deliberately vague about it. This is not the federal government catching fraudsters and recovering stolen money. Minnesota already paid its Medicaid providers. The state already sent the checks. What the federal government is now doing is refusing to pay the state back for those costs, meaning providers who already delivered services to real patients may not get paid, and the 1.2 million Minnesotans on Medicaid could see disruptions in their care, because his advice to them was to call their governor. According to Akeisa Coleman, a Medicaid policy expert at the Commonwealth Fund, a leading healthcare research organization, this type of funding freeze is, in her words, a highly unusual step. Minnesota had already been fighting a separate move to block $2 billion a year starting in January, also from Oz, had asked for an official government hearing to challenge that decision. And as of this announcement, CMS hadn't even scheduled one. The state has submitted a written correction plan. They were already doing the thing he's demanding on television. So then the obvious question becomes, why Minnesota? According to Becker's Hospital Review, Texas had the most Medicaid fraud dollars recovered in 2022. Florida is described by medical billing expert Michael Arrigo, writing for the Center Square as, and I'm quoting, a hotspot for Medicaid and Medicare fraud, not just in terms of volume, but value. And here's the detail I want you to have for every conversation you have about this. According to KFF Health News, in his first and second terms combined, Trump has granted pardons or sentence reductions to at least 68 people convicted of fraud crimes, including, last May, commuting the sentence of Lawrence Duran, a Miami healthcare executive who received the longest Medicare fraud sentence in American history, 50 years in prison for running a $205 million scheme that targeted elderly patients with Alzheimer's and dementia. 50 years commuted. Meanwhile, Minnesota, with a 2.1% error rate, gets the press conference. Funny how that works. What Walz called it is important, a campaign of retribution. And the pattern here isn't subtle. The administration used fraud allegations involving Minnesota's Somali community to justify a massive wave of immigration raids across the state. Now they're using fraud allegations to freeze Medicaid funding. The first target in the national war on fraud is the governor who ran as the Democratic candidate for vice president. You are allowed to notice that. So what does this actually mean for people? According to the Kaiser Family Foundation, nationally, Medicaid covers over 60% of nursing home residents. And 3/4 of working-age adults on Medicaid are in families where at least one person has a job, meaning this program isn't a safety net for people who don't work. It's a safety net for people who do work, but whose jobs don't come with health insurance. Those people, 1.2 million of them in Minnesota, are now being told that their care might be disrupted. And the solution is to call their governor. It's the healthcare equivalent of your landlord shutting off the heat in January and suggesting you take it up with the city council. Josh Berg, who runs the nonprofit Accessible Space Incorporated, told CBS Minnesota that if this becomes a freeze quarter after quarter, policymakers are going to have to make difficult decisions to balance the budget. And this is happening while Minnesota is already staring down a multi-billion-dollar budget gap heading into next year. The Georgetown Center for Children and Families researchers made a point worth sitting with. CMS has the legal authority to freeze funds, but that authority was designed as a cooperative tool to help states improve their programs, not as a first strike against states that are already performing well above the national average. When you turn a rule-following tool into a weapon against a state that is already following the rules, you're not enforcing the law. You're twisting the law to get the result you already decided you wanted. And the states watching this, not just Minnesota, are now on notice that federal Medicaid funding can be frozen for political purposes, regardless of their actual fraud record. And for what? He says this is about protecting the vulnerable people who depend on Medicaid, the seniors, the kids, the people with disabilities. But the people most immediately harmed by freezing $259 million in payments that a state is owed after already paying its healthcare providers are precisely those people. So either he hasn't thought through the logic of his own plan, or he has and he doesn't particularly care. And given that this is the man who was called before a Senate committee to answer for pushing miracle weight loss cures on television, I'll let you draw your own conclusions about which one it is. Green coffee bean extract, for the record, has never been shown to produce significant weight loss. But sure, let's give this man control over $2 trillion in federal healthcare spending. As of today, Minnesota has 60 days to respond to the $259 million freeze, is simultaneously appealing the separate move to block $2 billion a year, with no hearing date yet scheduled, and Governor Walz unveiled an 18-point anti-fraud package the very next day, including proposals for a new Office of Inspector General. So the state being punished for not taking fraud seriously is actively doing anti-fraud work while the punishment is being handed down. You genuinely cannot make this up. This isn't about Medicaid fraud. Every state has Medicaid fraud. Texas and Florida have fraud problems that dwarf Minnesota's on the actual numbers, and none of them are getting the White House press conference treatment. What this is about is that the administration found a legal tool, one originally designed to help the federal government and states work together to fix problems, and turned it into a political weapon. They're not fighting fraud, they're fighting Tim Walz, and they're using 1.2 million sick and elderly and disabled Minnesotans as the leverage. The opening analogy I used was about handing a littering ticket to the guy who cleans up the block. But here's the darker version. They're not confused about who's littering. They know exactly what they're doing. The honor roll student got the detention slip because they needed to make an example of somebody, and they needed that somebody to be the governor who ran against them in November. The people who will actually feel this in disrupted home care services, in rural clinics that can't keep their doors open without getting paid back by the federal government, in nursing homes trying to figure out their quarterly budget, they're not part of the calculation at all. Just like green coffee bean extract was never really about your health. But the segment was very compelling. If you believe facts still matter, hit like so more people see this, drop a comment with your thoughts below, share this with someone who needs the full story, not just the headline, and don't forget to click the bell and subscribe so you never miss the next breakdown. Thanks for watching, and I will catch you guys in the next video. Thanks, bye.